Welcome to PALS. It's Professor Anyanwu's Anatomy Lecture Series. In today's lecture, we'll continue with our study of muscles around the pectoral region. In our earlier lecture, we started with the muscle trapezius. We looked at the trapezius muscle. But in today's lecture, we'll start with Latissimus Dorsi. This is the muscle Latissimus Dorsi. That's the muscle, Latissimus Dorsi. Now, Latissimus Dorsi is a muscle that we see at the back. It has a triangular shape, and then it's very wide. In fact, the name Latissimus means widest at the back. It's actually the widest at the back. Both the left and right Latissimus Dorsi will form a superficial layer that will cover most of the lower half of the back. It's actually covered on the upper part by the trapezius. So otherwise, it actually would have been the most superficial muscle at the back, except at the upper part where it is covered by the trapezius, the lower fibers of the trapezius. Now for this muscle is a very special muscle. One, because of its wide origin. It has a very wide origin, and then it has a small insertion. Also, it is the only muscle in the upper limb that has connection with the lower limb. So we're going to start with this muscle. First, we're going to start with the origin. Now, Latissimus Dorsi, in its origin, we will see the various parts it has origin. We have the origin that will be around the vertebral column. We also have origin that will be coming from around the ilium, the iliac crest, the iliac crest of the ilium. We also have another origin that will be coming from the scapula. We also have another origin that will be coming from the ribs. So we'll look at the specific areas these origins will be coming from. Let's start with the origin from the vertebral column. The vertebral column. That's the origin from the vertebral column. Now, for the origin from the vertebral column, we will try to look at the various parts. Now we have the part that runs from the lower 6 thoracic vertebra. The lower 6, that is from T7 to T12. The part of this vertebra involved is the spines. So we have origin from the spines of the lower 6 thoracic vertebra. That's one. Then also along the vertebra too, we have this origin from the thoracolumbar fascia. Thoracolumbar fascia. Now, it's actually from the posterior lamina of the thoracolumbar fascia. Thoracolumbar fascia is a fascia that runs from the thoracic region down to the lumbar region and even down to the sacral region. It's a fascia. Now, this muscle picks origin from the posterior lamina of this fascia. This fascia has attachment on the spines of both lumbar and sacral vertebra. So, by reason of this muscle picking origin from the posterior lamina of the thoracolumbar fascia, it also, by extension, picks origin from the spines of both the lumbar and the sacral vertebra. We also have origin from the ilium. Now, we have the iliac crest. In the iliac crest, that's around here. We have the external lip of the iliac crest. That's the iliac crest. We have the external lip of the iliac crest. Now, this muscle also picks origin from the iliac crest, posterior aspect of the iliac crest. The external lip of the iliac crest, the one in the posterior aspect. So we have that origin there. Now, as this muscle also keeps moving up, we see other origins too. We see this muscle also picking origin from the inferior angle of the scapula. That's the scapula. Now, this is the inferior angle. From this, that's the muscle origin. The little dot here. That's the latissimus dorsi, that's the origin. Now, we also have the origins from the ribs. Now, from the ribs, we see this muscle as it moves up. It picks origin from the lower 3 to 4 ribs. The lower 3 to 4 ribs. So, these wide regions will form the origin of the latissimus dorsi. Let's also take these origins from here. We said from this lower thoracic region that the origin is from the spines of the thoracic vertebra. Now we said within the lumbar and the sacral region that the origin is from the postural lamina of the thoracolumbar fascia. Now we also said that from the iliac crest, external leak of the iliac crest, it picked origin from the postural aspect of the external leak of the iliac crest, and then they'll keep moving up. And then while they are coming up, we also noted the origins from the lower 3 or 4 ribs, and finally from the inferior angle of the scapula. We now go to the insertion. Now, while this muscle is moving towards the narrow point of its insertion, we'll notice the various fibers and how they run. Now, we'll notice the upper fibers. If we come close to the diagram we have, we'll notice that the upper fibers, these are the upper fibers, they are running horizontally, almost horizontally. Now, the middle fibers and the lower fibers have various degrees of obliquity. So the middle fibers run obliquely as they all run laterally towards the insertion at the humerus. Now, the middle fibers run oblique, and then the lowest fibers run more oblique. Some of the fibers are even running vertically towards the lateral aspect. Now, the insertion. This muscle, as we noted, actually has a very narrow insertion. How does it get there? It gets to this point. This is the inferior angle of the scapula. At this point of the inferior angle of the scapula, we are seeing a muscle, Teres Major. Teres Major is at this point. This muscle does two things. It will first approach Teres Major, running below it, and now as it gets towards it, it runs behind it, and then twists around Teres Major. It has 3-point relationship: 1 below it, 2 behind it, and then the third one anterior to it. It will run to its insertion. Now this is the humerus. This is the proximal part of the humerus. Now, this is let's identify the diagram. This is the head, this is the greater tubercle. Somewhere here is a lesser tubercle. Now we're seeing the points of attachment of some muscles. The one of interest to us now is the point here, which is the floor of the bicipital sulcus. This is the lateral lip, this is the medial lip. At the lateral lip, we're seeing different muscles inserting, but our interest now is the floor, where we're seeing the latissimus dorsi inserting. So latissimus dorsi runs this course and then twists itself and then gets inserted at the floor of the bicipital sulcus. Actually, at that point of the Teres Major, when it circled round, twisted on itself around the Teres Major, it twisted on itself, now running anterior surface running posteriorly, and then by that twisting, what happens here is that the lowest fibers, the fibers that originated the lowest will be inserting the highest by that twisting. And the fibers that originated the highest will be inserting the lowest. As the fibers of latissimus dorsi run to their insertion, we see them defining borders of 2 triangles. Right here, we see the triangle at the lower part, which is the lumbar triangle or triangle of Potier. Sometimes they call it the inferior lumbar triangle. So at this point, we see the borders. This muscle is the external oblique muscle forming the anterior border. Here we see the lateral fibers of Latissimus dorsi forming the posterior border. And then here we see the iliac crest forming the inferior border. So at the floor, we see the fibers of the internal oblique forming the floor. So these fibers form one of the borders of this lumbar triangle or triangle of Petit. This triangle can be a point of abdominal herniation. Now, we also see another triangle that these fibers define. This was by the lateral fibers. Here we see the upper fibers also defining another triangle. The triangle we see here is the triangle of auscultation. The triangle of auscultation is a point in this posterior wall where the sounds of the lungs can be gotten clearly or auscultated. So for this triangle of auscultation, we see the lateral border being formed by the medial border of the scapula, lower border being formed by the upper fibers of the trapezius, and then the medial border being formed by the lateral border of the lower fibers of trapezius. So let's trace this. Well, let's look at this, the nerve supply and action of this muscle. Now, for the nerve supply, we will recall thoracodorsal nerve supply. The thoracodorsal nerve is the nerve that innervates this muscle. And thoracodorsal nerve is one of the branches from the posterior cord. That's thoracodorsal nerve. For action, we see by virtue of where this muscle is coming from, we see this muscle doing a number of actions. One, this muscle is an extensor of the shoulder joint. It's an extensor of the shoulder joint. Look at where it's coming from. Now, because it's coming from the back and moving to this point, it is easy to extend the shoulder joint. That's extension. Now, also because it is coming from the back and coming to this point, certainly at this point, it is also easy to do the work of adduction. That's adduction. It adducts, brings the arm close. Now also, by virtue of where it's inserting at its origin, it's also able to do medial rotation. Medial rotation. So this muscle is an extensor, is one an extensor, two is an adductor, and three, it is a medial rotator. It's involved in medial rotation. Also, by means of attachment to the iliac crest, to the trunk, it is able to also pull the trunk up and forward. Such movements as we see during climbing. So the muscle is able to pull the trunk upwards and forwards. Now, lastly, we also see this muscle getting involved in respiration, particularly in forceful expiration. Now, you notice that from both angles, this muscle wrapped around the chest and also the scapula wrapped around the chest. And then if this muscle contracts, it gives it the ability to trigger forceful expiration, as is seen in coughing or sneezing. Now, let us look at the clinical anatomy. The clinical anatomy. Now, in the clinical anatomy, we see some things that this muscle could be used to do. Now, this muscle, if we recall, is supplied by thoracodorsal artery, a branch from subscapular artery. Thoracodorsal artery is actually the terminal branch, or is a continuation of subscapular artery. This artery is followed by its vena comitans, tricutis vein. And also we've mentioned the nerve, which is tricutis nerve. Now, this muscle has what we call single and dominant vascular pedicle. It is supplied by this single vessel, and as a result of this, it's easy to move this muscle around. That's why this muscle is seen in a number of reconstructive surgeries. Now, this muscle, as a result of this single dominant vascular pedicle, can be used in breast reconstructive surgeries, where it can be moved. Number 2, this muscle can be conditioned to act as a cardiac muscle. So when this is done, it can now be used as an autotransplant to restore some surgically removed portions of the cardiac muscle. This is all we can take on Latissimus Dorsi. Thank you very much.